Inequalities in childhood stunting in Ethiopia. What is childhood stunting? Are male or female children are more affected by stunting? Urban or rural children more burdened by stunting? Which regions have more prevalence and why? Stunting is the impaired growth and development that children experience from poor nutrition, repeated infection, and inadequate psychosocial stimulation. Children are defined as stunted if their height for age is more than 2 standard deviations below the World Health Organization Child Growth Standards median. Childhood stunting is impaired growth and development resulting from poor nutrition during the first 2 years of life. The consequences of childhood stunting within the first 1,000 days are significant. The impact on child brain development will subsequently result in long-term negative outcomes such as reduced school performance. There are many factors that contribute to childhood stunting, and these factors are often linked. Some common factors linked to stunting include poor nutrition and a lack of access to diverse foods, poor sanitation and no access to clean drinking water, lack of proper health care for children and their mothers, inadequate psychosocial stimulation and/or parent-infant bonding. This is a ubiquitous global public health problem threatening under 5 children and impairing their health, economy, and development. In 2018, approximately 149 million of under 5 children across the globe suffered from stunting. The global distribution is skewed with over half of stunted children found in Africa and Asia. Like most African countries, Ethiopia has one of the highest concentrations of stunting, where less than 1 in 3 children is either moderately or severely stunted. Literature has shown variations in the stunting prevalence across different subpopulations. Stunted children often come from economically deprived and uneducated subpopulations. Furthermore, children born in rural areas are at a higher risk of experiencing stunting than their counterparts in urban settings. In country, region or district-related variations of stunting have also been documented within a country. Interestingly, sex differential studies have shown that male children are more likely to be stunted than female children. The United Nations, UN, and the World Health Organization, WHO, have flagged the importance of improving stunting through global targets and goals. To realistically reach the Sustainable Development Goal of reducing malnutrition and achieve the 40% reduction in the number of children under 5 who are stunted, it is necessary to direct research and policy attention to subpopulations experiencing the disproportionately higher burden of stunting. According to this study, both absolute and relative inequalities in stunting exist in all the studied years in Ethiopia. The inequality disfavors children of mothers who are poor, uneducated, and living in rural areas and specific regions such as Amhara. The pro-rich and pro-educated are seen with inequalities slightly increased with time. Male children bear a disproportionately higher burden of stunting, and the disparity increased between the first and the last time points based on complex measures but remained constant with simple measures. Similarly, both the subnational, regional and residence-related stunting disparities generally widened over time according to some of the inequality measures. In conclusions, stunting appeared to be highly prevalent among certain subgroups, i.e. poor, uneducated, and living in rural regions. The subpopulations experiencing excessively high stunting prevalence should be the focus of policy makers' attention as they work to achieve the WHO 40% reduction in stunting target by 2025 and the Union Agenda 2030 for Sustainable Development Goals.